Okay, hello everyone, all of you here and online, and welcome to the All Souls Community Forum, coming to you from All Souls Unitarian Universalist Church in Kansas City. I'm Joe Robertson, a member of this church and a member of the Forum Committee, a forum that has for nearly 80 years been leading important and compelling conversations on issues of the day. Today, we are excited to have as our speaker Dr. Marvia Jones. Dr. Jones is the health director of the city of Kansas City, newly appointed in February, and she is one of the nationally recognized 40 under 40 public health leaders. I got to know her with her specializing in violence prevention and health policy, which was her specialty when she was working at the Centers for Disease Control in Atlanta. So we will be hearing about the heart of our city today. We're ready for our checkup. Dr. Jones, welcome to the forum.
Thank you so much, Joe, for the warm welcome. And anytime Joe calls me, I come because I know how much he cares about the community. So wherever he drags me off to, I'll be there. So thank you all for being here today. Okay. Thank you all for being here today. I want to just get it out the way. Yes, you will hear a twang. I'm originally from Jacksonville, Florida, which is the northern part of Florida. Been here since 2010, where I moved with my husband to begin grad school, and he is a native Kansas City, and so that's my tie to the city. But yes, you will hear the twang, and it's especially right this morning because I haven't had a long time to wake up and get it out of my system. So anyway, that's where it's from. So I really am honored to be here today to talk to you about what we're doing in public health and some ways that it has changed maybe since before going into COVID. We are still the same field as you know, public health, or you may know, public health is concerned with the health of a population or the health of a community. So, whereas healthcare or medical care is about how do we treat each individual person and give them the very best care that they can receive when they step into the place of service. Public health says whether you come and see us or not, whether we ever know about you individually, we want to do what we can to make sure that your environment and your lifestyle can be healthy. And so that's what public health is about. I know that in some of the church traditions, you know, and faith traditions, we like to have titles for our things. So if I had a title to choose a title for my talk today, it would be Things We Pulled from the Fire. I don't know if y'all remember that movie back in, I mean, it's been over 10 years ago, but there's a movie called Things We Lost in the Fire, you know, and it's about this lady or this family and some friends who lose, you know, her partner in a violent act. And so then she is sort of damaged and she's getting into damaged relationships and things like that. And so it's kind of sad. It's a tragedy. But I want to say things we pulled from the fire because just like so many of the wars that we were in, we talk about the Civil War, we talk about World Wars One and Two, and even if we get more recent to the Spanish flu, we learned some things from those fires. Those were fires that ripped through our communities, they ripped through our country, but we pulled some things from them. And so even still, I consider the pandemic that we are hopefully on the tail end of to be a fire that has ripped through and has impacted so many of our families. But there's still things that we can learn from that experience. So the first thing I want to talk about, one of the lessons we've learned and that we've carried forward, pulled from this fire, and that has changed the way that I approach my work, is the understanding that we are internet interconnected, and there is no winning without the most vulnerable among us. So, you know, if you remember in 2020, when the messages first went out, the messaging was, hey, shelter in place, and some places called it that. Some people called it the dreaded lockdown. Some people said shelter in place. Some people said stay at home. You had people began to stay at home. That's what they did. Churches, many of you, as you remember, we stopped gathering the way that we used to. Some folks took longer than others, but for the most part, doors sort of closed. People went online. And what did we start doing? So many of us, in being safe, we started dialing up our groceries. You know, I have never used so many digital platforms than I did over the past couple years. So many of us discovered you can get your groceries delivered to your front door. You can get your food delivered to you. You can order at pretty much any restaurant and get your food delivered to your door. Like some of us were just overjoyed and we said, I'm being careful. I wear my mask, I get my vaccine once it was available, and I get my stuff delivered. I'm being safe. Well, who do we think is delivering our groceries and our food? Who is still coming out and making the food? The people who were processing the meat. We learned that when chicken wings and stuff went sky high. And well, it's because so many people in the factory got COVID. And so they had to slow down on how fast they were processing the meat. And of course, you know, that means higher prices for most people, right? So we learned during this process that we are very interconnected. And when you, even when you feel like one group can be made safe or you can encourage them to be safe, we are not ever really safe as a unit, as a population, because there are some people who are still vulnerable. There are some of us who say that this virus is still circulating the way that it is and it continues to mutate in part because everybody was not able to pause in the same way. We still have people who have had to be out and about, people still working long hours, people still working shift work that tends to wear down the immunity of your body. We still have people who are working in a tight back room kitchen where if someone's sick, everyone's sick. That shouldn't have really been a surprise to us because even if we go out to eat, we're aware. Do we know what goes into our food? Do we know that the folks who are preparing the food, many of them do not have paid leave? So if they got a tummy bug or they've got a cough, well, they're showing up to work. And so our health has been impacted already by people who are most vulnerable in our communities. But COVID-19 kind of shined a spotlight to say, no, really, you are really connected. There is no outrunning, there is no moving to the countryside, there is no escape of the system that we all have here in our community. And so the best thing is for us to work on those things. The Kansas City, one of my first things I did when getting into my role, once realizing this interconnectedness and that we never really be free as a group until all of us were free of this vulnerability. And I said about trying to get paid sick leave policy. So some states, some cities are able to, write a local ordinance, and then every employer who employs Kansas City residents has to have paid sick leave. And I wasn't asking for anything lavish, not 10, 15 days, but 2 to 5 days of paid sick leave so that the average person gets a cold or a bug about five, no, adult gets it about 5 times a year. So, okay, let's just get a day, can we just get a day for each time? And what I found, unfortunately, was that because of the state we're in, the Missouri legislature has said that no local ordinance can be written that impacts anything to do with pay. So that's the same reason why we couldn't pass a minimum wage ordinance. In that same vein, we can't pass an ordinance that requires employers to pay sick leave. And so that was disconcerting. What we did, sort of a consolation, was to move up the paid sick leave for city of Kansas City residents, those residents who work for the city. I was able to get days added earlier in their process. For some reason, we formerly had a strange rule that you had to work almost 3, 4 months before you had enough hours accrued to take a day or two of leave. And I said, well, surely at least the city of Kansas City can do a little better than that. And so that came out of that, but it just reminds me daily that the most vulnerable will continue to make us we will all be vulnerable as long as they are not taken care of. We talk about emergency wait times. Many of you heard about how, well, people are trying to get treatment, but the hospitals are too full. And so then there became this argument of, oh, well, are they really there for COVID, or are they with other stuff? And they're not there for COVID. Well, the correct answer is not everybody was there for COVID in the emergency rooms. However, the people who usually use the emergency room for their health care were more vulnerable to COVID-19. They already had higher rates of diabetes and cancers that they had let get kind of out of control. They had maybe not had a chance to go in and earlier to get things taken care of. And so when some of us needed to go and get heart our heart conditions checked out, or that surgery we had been waiting 2 years on. Yes, we did find full, overfilled doctor's offices as well as emergency rooms. And so that's yet another way that all of us were impacted by the fact that some people continue to be more vulnerable, and that the inequities in our society, again, touch all of us. So all of us were still trying to get the same health care that we received before, but being hindered by the fact that we hadn't been able to protect the most vulnerable among us. Okay, so the next thing that we pulled from the fire, besides this idea that we're all interconnected, which, yes, we should have known that already, but sometimes some of us need good reminders, right? So the next thing that we learned, sorry, I lost the screen closing up, is that we as a public health system have to be all things to people. So they're all things to all people. We have to remember how to be, how to speak and how to show up in different spaces. So we know that some people have had the benefit of an advanced education. Some folks have gone to undergraduate and graduate school, and they've become their vocabulary is expanded in a way that some people who had not is they've been able to have experiences that allow them to understand biology. Some of us had different high school science classes that allowed us to know more about how the world works, right? And then there are those of us who did not. There are those of us who went to schools that maybe didn't have the best science teaching. We didn't have the availability of teachers, right, who could even teach math and science in the way we needed, right? So we all grow up together. You know, the Bible talks about us growing, all the wheat and the tares all growing up together. We all come up together and we find ourselves in the same positions where here public health shows up and we start talking about immunocompromised and we start talking about hemoglobin levels and we start talking about all these things and we expect people to just grasp it, just get it. You know, when I tell you if you're immunocompromised, you may consider a quarterly booster session for your such and such, such and such. Some of you give me blank looks. I go many places and most people give me blank looks. Some of us are still trying to figure out if we need a second booster because of the way that it has been communicated to us. And so, what this process has taught us, speaking of things we pulled from the fire, is that we have to be very mindful of how we use language and how language can sometimes be a barrier and how it can be used to divide. So, some of you who are information seekers, if you hear a word you don't know or you don't really understand what you just heard on the radio or that you saw on the news and you want more information, you'll go on that Google and you'll work that thing and you'll get what you need to get. You'll go down a rabbit hole. I'm one of those rabbit hole people. I'll go down a rabbit hole to find out what I need, right? There's some of us who are just, that's just the way we were crafted. That's how we're made. And then there's some people, when they hear something they don't understand, they immediately say, they're not talking to me. They don't want me to understand. They think they're better than me. Forget all of them. And so what we have seen over the past 3 years is a sad, maddeningly concerning amount of people who have taken that mindset. They're not talking to me. They don't really care about me. This isn't for me. There's some conspiracy going on. I'm just going to tune it all out. I'm going to go to the people who talk to me. And the people who are talking to them or who they perceive as talking to them has not been some of the healthiest places. We get a bunch of conspiracy talk. They feed into this mindset that the other people are against them. There's some conspiracy. We're trying to kill people off. We're trying to control them. We're trying to do all these things. And it really is sad and disappointing as someone in the public health field because you go into this field because you have great intentions. You see things that you want to make a difference in. You care about people and not just one person at a time. I could be a doctor, but they don't see enough people. I need to be a healthcare person for a whole population. And to have been targeted and to be assumed or presumed that you're trying to do something different is very painful for all the folks, for many of the folks who work in this field. So we realize, and what we have decided is we need to be better about the way that we talk. You know, we go to school, we get these masters of public health degrees, master of public health degrees, we get these PhDs. You know, we talk to the public the way that we talk to each other. And so when you see things talking about immunocompromise, now y'all probably know what that means by now. You know, some people still don't understand that that means if you have any condition that in some way weakens your ability to fight off a disease. But when it first came out and we were first talking like that, we just, oh yeah, that's a word. Do you know how many letters are in that word? I didn't count them yet, but it's a lot. It's a long word, right? And it can be, if you sound it out and think about it, you could figure it out. But some people just tune out. Many people, too many people simply tune out. And so what we have realized is we cannot talk as if we're talking to everyone who has studied the same things that we've studied. We've got to figure out a way how to humble ourselves, have some humility in our approach to discussing these things and our humility in how we talk to people. Some of humility is just really trying to show up to other people the way that they are and saying, hey, I value you and I value your space and I value this opportunity to talk to you. So I'm going to talk to you in the way that you want to receive it. The people who are pushing the conspiracy stuff have already figured this out. So why has the scientific and the public health and the medical community, we are being a little bit too slow in picking that up? But that's something we have learned. And the other aspect of humility is understanding that I may not be the best messenger. Not everyone is the best messenger. My father has a less than high school degree or diploma. He was not able to get that. And my mother recently got her associate's degree into her adulthood. And so I consider myself who has a very working class understanding of language. I'm very well versed in speaking to people who identify as working class. But at some point, someone told me a couple of years ago, I'm in a event like this, and I'm talking. I think we were at one of the community centers, and a gentleman stands up after I've talked, and he said, "There you go, talking that you don't care about me, and you're not even talking to me." And I was like, "What?" It's a very painful feeling that if you pride yourself on communication and you pride yourself on being all things to all people and having maintained, hey, my dad lets me know real quick when I'm using college work. So I'm pretty good at this, but to be told you're out of touch, I don't understand what you're saying. It's very humbling. And it was a very, once I got through that, I realized, okay, I need to watch my language even more. And I need to employ people who have a more direct connection, who maybe have not lost their connection and their ability to speak in a way that folks understand. And so, what we have done at the health department is you may have heard about it, we have a community wellness ambassador program we started a few months ago. And what this is we actually went out and requested or really recruited cashiers and hairdressers and store clerks and all the folks that you would see just kind of on a regular day throughout the community. And we bring them in once a month. We have a morning session, we have an evening session to try to accommodate everybody's schedules. We bring them in and just basically open the windows on everything we do at the health department. Here's what we do in environmental. If you hear about a restaurant getting shut down, here's why. Here's our process. Here are the team members who go out. We're not some magic wizard people behind the veil. We're just regular people. And here are some of these folks who work out there. Here's what we're telling people about COVID. Here's our STD clinic. Ask us any questions you have, and you be our ambassador to the community so that Marvia Jones, Dr. Jones, doesn't have to be the one telling everybody what's recommended by public health. You can be that person, and you know how to talk to your colleague who's also a cashier clerk. Love everybody. Everyone has their value, but we do sometimes speak different languages, and these folks know those languages. And so we have seen significant um success, I will say, in that program, just from them being, these folks feel empowered. We have about 48 of them right now. They talk about feeling like, oh my goodness, I was already the person that people turn to, but now I have something, information to give them, and I know it's coming directly from the right source. And so I can give it to them, and they look to me as one of these leaders. Well, guess what happened? People stopped calling the health department as much as they used to. We used to get all types of calls for people to, come send someone out to talk to us about heart disease. Can you send someone to my church to talk about STD health or sexual health? Or can you send someone to talk about this? And it is so interesting to find that we have in some ways been replaced by people who are already out in the community. And so that is just another thing where it says, Marvia, be humble about that. It's not that you guys are desired any less or any less valuable, but these people have identified their target audience, and their audience trusts them. And they trust them a little bit more than they trust me. I'm a part of a local government entity. I understand the context around that. So that makes a lot of sense. All right. I want to go to my next topic, and I'm almost done, y'all. Is people are not segmented. So a person is made up of much more than just their physical health. And y'all know that, right? A person is more than just whether or not they are feeling sick at a given moment, their physical health. That's what we focused on at the pandemic. During the pandemic, we focused on keeping people from getting this infection, right? Stay inside, wear your mask, get these vaccines. Those were our talking points throughout that time. We wanted to make sure that people's physical health was well. What we have seen since the pandemic, and what we learned we maybe should have paid more attention to, was that mental well-being has continued to plummet during or as we get to the tail end of the pandemic. We have seen children who are suffering more from anxiety and depression. We have seen households, more divorces, more unstructuring of households, I'll say. We have seen people continuing to increase their usage of substances. We have seen our suicide rates increase among youth, young children, teenagers, as well as middle aged people. And so what we realize is that we may be in our plan for how to deal with a pandemic, that old dusty plan that we had developed years ago, decades and 50 years ago that we just suddenly pulled out. We need to put mental health care in there. We need to put mental well-being into our plans going forward. How do we think about that? When we're telling people how to stay home and how to disconnect from so many of the things that they loved, can we give them some tips for how to talk to their family about that? How to talk to their kids about that? How to get them through? How to build the resilience of a community that has been devastated by loss? And so we realized that we have to certainly focus on mental health as well. We also need our church faith partners to continue to nourish the mental health and social emotional health of our people. We need people to help us understand how to carry on healthy relationships in our households, but also outside of them. We saw people again run to these websites and run to these online sources. We've seen the radicalization of people becoming more and more radical over the past 3 years as they've turned to, instead of another person, instead of a trusted person, instead of a pastor, instead of a brother or sister at their church or a friend, their next door neighbor, that's not who they've turned to. They've turned to people on the internet who don't know them, who have their own agenda. And so we see that, I sort of see that as in some cases of personal failing of being able to remind people of the importance of these connections as well as their mental and emotional health. So I want us to just keep that in mind and remember that as many of you, if you are a part of a faith community, thinking about how you can talk to your peers. One of the things we're trying to do is make it okay to say, hey, I'm not okay right now. And how do we talk to each other about that? I don't know about you all. I'm sure you guys attend, hopefully, faith communities where you feel well supported. But I remember coming into church after I started having my babies. I was in grad school, and my husband and I were trying to struggle through grad school, and you know, stress of that, and then we decided let's start having kids too. And that was a great idea. And so I remember being a first time mom, being a very young, underslept mom. And I remember going to church. And the first thing that was spoken to me was, where you been? You know, we missed you. We missed you. We were like the go. Y'all know the couple, the go getter young couple. They're there whenever the doors are opened. You're on every ministry. You're cleaning. You're teaching Bible study. You're doing all of that. And then I had started having kids. And after that point, I became a spotty Christian. I was here sometimes, and sometimes I wasn't. If I was sleepy, me and the baby were home. You know, and the first thing they said was, where you been? We missed you. You set an example for the rest of the young people in our church. And this was many years ago. That was 2012 and 2014. My kids are much older now, still having trouble sleeping all the time sometimes, but much older. But as we went through this process, it made me realize our church even has to change. Our faith community has to change. Because when I would say, I'm struggling, I'm struggling. This marriage is different now, school and work and all of this. And now I have a baby on top of this. I was told, pray about it. Pray about it. How's your prayer life? What I wish, and I look forward to going forward in our faith communities, is a system where we support people. Say, hey, you say you're feeling down and you feeling this, and you're not sleeping and you're looking a little different. Hey, did you talk to your doctor about postpartum depression? Are you feeling anxiety? Do you feel this and this? Okay, can I talk to you about that? By the way, this would be golden. Let me pull out this screener I got from the health department and just ask you a few questions. Okay, no, that's not it. Okay, well, you need to sleep. Is there something someone can do and come over? Do you need more meals? Do you need somebody to come over and sit with you for a day or so? This is the kind of way that we can be this sort of wraparound entity, and this is where the faith community can really shine, is in showing that support. Yes, people need to pray, and yes, people need to have a healthy spiritual life, but we realize that mental and emotional health is so important. So I don't want to hold you too much longer, and I know there's a Q&A session, and so I always say I'm here for a good time, not a long time. So I just encourage you to continue what you're doing and learning about the community and thinking. I know that Also is very active in the community and advocating for issues that you care about. Any issues that impact the most vulnerable among us, the Medicaid expansion, of course, continue to please. I think I can say this. I'm not on the clock right now. Please continue to support those efforts, as well as anything such as paid sick leave that we can use that would not just benefit those people who are vulnerable, but it actually would help all of us because all of us depend upon those folks who find themselves in a position where they can't even take a day off because they're sick. I want to thank y'all for listening to me ramble. And I just really appreciate this opportunity. So y'all have I'll sit down now. So I about to say have a great day, but okay. Thank you. Thank you.
Okay, yeah. So we are going to thank you, Dr. Jones. We're going to go into our question and answer portion of the forum. Now, first, we'll also take a quick pause here to take up a collection to support this program. And I'm also going to use this moment to give you a heads up on our forum next Sunday, which is Attorney Bob I, who has represented abortion providers across the state and in the Kansas Supreme Court. He will be here to talk about where we're headed in the struggle of abortion rights. And so today we've been listening to Dr. Marvia Jones, Health Director, City of Kansas City, and we're going to welcome now your questions. And so you do it from here, right here, where I am at this microphone. And then those of you who are following along on YouTube, you can write your questions in the chat, and we'll be monitoring those, and we monitoring those, and I will ask those for you. Okay, so and remember, don't make statements. Just get a question here for Dr. Jones. Okay, and thank you very much. And here we go.
It seems to me that for some time I have noticed a substantial increase in coverage of the health department as well as health issues in general by the media, particularly TV news, but also radio news. Um, was one of your goals when you came into the job to have increased coverage of all those issues, and particularly what the health department is doing relating to those issues? Was that one of your goals when you came in?
Hmm. Thank you. That's a very reflective question. I don't think my goal was to have more coverage. My goal, however, my goal was to show the community that we heard them. We had heard them. So people had been coming up to me saying, "Why do y'all focus on all of this, but you're not talking about mental health? Why are you doing this and you're not showing your presence in the community?" And so, in some ways, this has been a blessing that the media have covered this because it does give us an opportunity for someone in the audience to say, "Oh, I told them about that and they listened to me." So, yeah, that wasn't my goal, but it has been a helpful benefit. Mm. Good morning.
I have kind of two questions. One is how you're funded, and and has that funding increased, through the pandemic? And then the other is, I'm concerned about a lot of things. You know, Public health is so enormous that, I mean, how do you decide what areas to go toward, to try to improve? And I'm assuming that there's some kind of data collection. And I'm thinking in particular about gun violence and I guess your influence in the city to the city council. Do you have influence to our state government at all? How you're funded and then how you track data and how you sort of influence that.
Thank you. Great questions that I'm going to try to answer both of them kind of in the same way at the same time. So we are funded just from a technical standpoint, about 52% of our budget for the health department is grant based. And what that is a mixture of federal funding, so funding from the Center for Disease Control, that's where things like our COVID um, program goes through, is funded by. And we're funded for HIV services through the federal Ryan White program. So these are sort of federal things. And then there are some state things. So being able to give children their back to school immunization, that's funded usually through the state, in part by the state. And then we have about 48% of our funding, or less than 48%, is based on local tax dollars. So our city health levy. And so that goes towards that. And then a small percentage is from like fees. So in order to fund our health inspectors who go out and inspect the pools and the hotels and the restaurants, that a lot of that is paid by fees. So we charge a fee for them to be in compliance, and so that helps support that program. Um, and that answer kind of answers your second question, is what guides our funding, what tells us where to go? Well, that's the challenge, because when you are primarily grant funded, that leads to you going a lot after a lot of grants. Some of those grants we kind of get every year. So the HIV services from the federal government, that's ongoing. Thankfully, we do have to apply and compete every year, but we've had a great track record and have continued to receive those funds. But the federal government, the federal public health um, agenda is sort of set, and they say we've identified these issues going on. We've seen an uptick in this. We've seen people struggling with that. That's what we're going to make money available to go after. And so that kind of leads you, as a lot of nonprofits, have experienced, where you go after those funding opportunities. The local dollars are supposed to be, that should be where we come in and we get to kind of say what the agenda should be based on the data. We do have an office of statisticians who collect data. Right now, they've been looking at, y'all heard us talk a couple years ago about lower life expectancy in certain parts of the city. We've taken it a step further to say, okay, for one, we know that the zip codes have changed. So I'm in 64108. That's where the health department is, in that Beacon Hill area. Well, Beacon Hill, I can assure you, is not a low life expectancy neighborhood. But 64108 used to be on that list. And so now it has changed. So we've had to update those data. But we've also started to look at smaller groups, like, hey, we only get a smaller, we get a smaller amount of money in our budget to address all these issues. So how do we focus them to the areas that need it the most, even inside of a zip code? So there might be parts of the Northland that may have been overlooked because their whole zip code was not, a low life expectancy area. But we found a few pockets in a zip code up there that could be. Even in some of the ones we typically talk about, 64130, well, the whole zip code is not bad. There are some pockets in some of these zip codes where there are people who've had jobs, they've had an education, they have a decent lifestyle. But there may be a few neighborhoods that have those issues. So we have done some data searching to highlight not just how much lower their life expectancy is, but what factors are contributing to that. Some of them, we found things like people who sleep for less than 6 or 7 hours a night. That's one of the factors that's kind of bubbled up in our analysis. We have found things like asthma. So we can say, okay, this zip code has a lower life expectancy than this other one, primarily because so many of the people here have asthma. So many people are going to the emergency room with asthma. What do you call it when it gets out of control? Uncontrolled asthma or uncontrolled diabetes. So that allows us to now say, all right, city council, mayor, city manager, here are the issues we've identified. In what way can our next budget reflect these other priorities? Sometimes it looks like a small addition to your budget from the city. Most times it looks like, okay, if you're going to focus on this, we have to sort of figure out how to de-emphasize some of these other areas. Maybe we can do less of this health issue and we have to focus more on this one. Right now, this is budget season where we're trying to do something. This is my first budget cycle in this position. So it's about to be really interesting. Um, One of the things you'll hear a lot of council people talk about is, does your budget reflects your values and respect, and should reflect your priorities. And so infrastructure right now with potholes, and we all want nice roads to drive on, we want our trash picked up well and all of that. My job as the health director is to say we need all of those things. We also have a contingent of people who don't have a basic life expectancy. When we were talking about low life expectancy before, we were talking about a range, I think, of 60, 68 to 84 or 85. That was kind of the range we said of life expectancy ages. Since we've done this analysis again, we've now found that there are parts of the city at some census tracts where the average life expectancy is in the 50s. It is 52 now. So that y'all heard that here first. We haven't put that data out yet. But that tells us that so now the range is like, and then at the higher end is now up to 88. So I talked to my statistician about the fact that if you can survive to a certain age, it's almost like you have a likelihood to have a longer life. But if you are an area where you have a high risk of asthma, you have a high risk of getting shot, you that life expectancy just gets pulled down so low. But if you can make it past that high risk age in our city, which is about 37, 38, then you have a greater likelihood of being able to survive longer. So I'm not trying to get it too buried in the data. Maybe I can come back another time and kind of really roll out that data. Is really exciting data, but some of it is sort of disappointing. Does that answer your question? Was there a piece I could go more into? I kind of well, I can hear you.
And I'll repeat it. Go ahead.
Well, I guess, and I'm thinking in particular, like maybe you see in 64130 gun violence,
Mm-hmm.
there's young people dying of gun violence. Then how do you take that data and do you go to the state? You go to the city council? How does that? Where do you go with it?
So the question is that the zip code data and gun violence. Where do you take the data? Where do you go to with that?
Where we go is as the director at the health department, we have the ability to sort of target our resources there. So we can say if we have 3 people who are working on this topic, I can tell them to focus on 64130. So spend your time there, do your mini grants or whatever, your programming focus there. We don't really take it to the state in that way. The state has not made funding available for anything like violence prevention. Um, we do let city council know though, because that would impact someone's district. That's Councilwoman Robinson, Councilman Ellington's district. They're usually aware, but they usually use that data to say, and here's why my district needs XYZ. So that's kind of how we can't advocate for a specific ordinance or anything. That would be lobbying, but we can share information. Here seems to be the greatest needs here. And sometimes the challenge can be people may assume the challenge, but we have our data that says, well, actually, it's this. I like the example. Let's take the example of gun violence. So if you turned on the news, you would assume gun violence is just the major thing that's going on, people shooting each other. What we know is that suicide is actually one of the higher forms of gun violence. So a third of things could be homicide, but 2/3 of the shootings in our region have been actually suicide. And so when you think about that, now it tells you, okay, well, okay, mental health is a bigger it should have already been a priority, but that's an even bigger priority, should be a bigger priority. Even when we think about homicide or assaults, if we there is a connection between asthma. If kids were missing a ton of school because they had asthma to the point where they were missing more days of school than they were in school, guess what? It's going to be very hard for them to graduate. It's going to be very hard for them to graduate high school. And what we know is that people who drop out of high school are at greater, like something like 7 times the risk of being a victim or a perpetrator of violence. And so it matters to me. I have to think in the long run, the kids today who are struggling with asthma and running to the ER with asthma, we've got to do something so that those kids aren't then a part of the wave 5, 10, 15 years from now of people who are being shot or who are shooting each other. And so that's sometimes the news media. I love them for those that are watching. Uh, I love you all. But we sometimes don't get an opportunity to make that type of connection. So I really appreciate opportunities like this because we get to talk about it in more detail. But that's not something the media wants. What's the one issue? What's the main issue? What's this issue? Um, and I'm like, okay, it's like most things in life, it's interconnected and it's more complex than just one thing, if that makes sense.
Okay, and yeah, we do have our YouTube audience. I got some questions here
Okay.
coming from that direction. I'm going to go ahead and give you 2 of them here, so you
Okay.
can. They're not related, so there'll be two. One, the first one is from from Craig is he wants to know how does the current COVID impact on hospitalizations compared to the usual flu impacts in Kansas City? That's number one. And number two from John is how is water quality monitored in Kansas City? Does the health department have a role in that?
Okay, thank you. Um, So water quality is managed. This is the easiest answer. Water quality is managed by the water department, and by the state health department, and the state environmental quality. So that's not something we weigh a lot in. The water department does a great job. They are held to certain accountability metrics on what can be in the water and all of that. If there is a problem, like there's an outbreak somewhere and it somehow gets traced back to water, then health department can be involved alongside the water department and the state, of course. Um, the hospitalization. So this is a very strange time to try to compare hospitalization. You know, it seems like the question is, when we think about hospitalization that usually occurs because of flu versus what we're seeing now with COVID. And our flu numbers have not ramped up locally like to that extent yet. So people aren't being hospitalized with flu right now in large numbers. The hard part about trying to compare right now is because we are almost 3 years into a process that has completely changed the way that people have sought healthcare. So we have people who stopped going to their primary doctors, people who, to my surprise, paused their cancer treatments. They delayed surgical operations, between 1 and 3 years. And so you now have, because we're all kind of a little bit more comfortable with being out and about now, these people decided a few months ago, well, I'm going to go back and get my appointment set and go ahead and get to the hospital. I'm going to go ahead and do this. So doctors are finding worsened conditions. We may pause our appointments or our treatments, but the disease that we were dealing with does not pause. It continues to progress. And so you have had increased hospitalizations for things like that, out of control diabetes, out of control blood pressure, stroke, all of those different things. And so our hospitals can be pretty full. With the other negative side, because throw that into this soup of problems, we have had healthcare providers who have gotten out of the field, who have said, I've had enough. I've been burnt out. I can't do another year of this. I can't. So at the same time, you have this backlog of need, you also have reduced capacity. So it might seem like there are beds there, but when the news talks about beds or capacity, and they're saying, oh, we're still short on capacity, that doesn't mean that the hospital is loaded with people. That means that the number of available beds or rooms plus the number of people who are able to staff those beds, because you can have a bed, but you got to have somebody to work it and give them what they need and watch them and all of that. That is at capacity. And so people say, oh, they're lying, I don't see this in the parking lot, or these beds are empty. Yeah, they might be empty because there's no one to work them. So it's still empty. I can't just put someone there. They can't just put someone in there. So it's hard to compare, but we do know that we are going to be working through this backlog for some time of people who have delayed care, and we need to get them taken care of. So it's hard to compare in that way, but I do want to use this opportunity to say, get your flu shots. The health department we have flu shots available. The ideal time so that you can prolong your immunity or the benefits from it, the shot, is somewhere by Halloween. So you want to get them before Halloween. Um, some people were trying to get them in August and all that, which is a little too early because you only get a certain amount of months out of it. If you get it too early, your immunity starts to wane in January, February, when that could be, we don't know yet, that could be the height of flu season. So, but if you get that October range, yeah, that would be great. And your booster.
Hey, one last question. The during COVID, you know, murders, homicides, those that rose, and then also like car fatalities. Kansas City police reported like there were more car crashes, more fatal car crashes. What? How do you? Anyway, what do you
Yeah.
make of that?
Yeah. Thank you. So I continue to say, without having written a paper on this or seen a whole bunch of papers on this, I continue to say that when you have higher rates of things like assault and homicide, that is a symptom. That is a symptom of the ills that are going on in a particular community or particular area. And so when we think about even car fatalities, this is people who are distracted. This is people who have over time become perhaps more addicted to technology, their phones. We've seen people spending more and more time on social media, to the point where you can look over in someone's car and see them scrolling on. I'm like, you're looking at Twitter in your car, and you're not stopped for that long to be looking at a YouTube video in your car while you're driving. The stoplight isn't that long, you know. Some of them seem like it on the plaza, but anyway, um, you this idea that people's minds, and there's, to me, that is a signal, that could be a signal of anxiety, depression. There's something where me needing to get this fixed, in the same way that many of us would use substances. And so to me, it says that people are not thinking clearly. They're not in their right minds. They are distracted. They are stressed. We know that inflation has been an issue for people. People are finding it harder to make ends meet. Um, so all of that tends to just cause negative outcomes in a number of ways. Unfortunately, some of them violent. I can hear you if you want to sit there and say, oh,
How do you
"Wake up."
how do you sort of counter a lot of the disinformation out there about taking horse pills or injecting Lysol to kill COVID?
Yeah. Some of it, okay, so there are two sort of philosophies, and I'm trying to uh, manage both of them right now. The one philosophy is you don't give some things the light of day. So one of the strategies is I don't necessarily tell the public that some people are trying to inject Lysol, or they're trying to sometimes when the media picks something up like that and carries it far and wide, then more people become exposed to it who wouldn't have known about it before. Um so we talk about how that can be a problem. You don't want to overexpose people to things like that. However, once we find out about it and it seems to be getting some traction, we now have people, that's another thing we kind of pulled from the fire. We now have people who are monitoring to see when any type of disinformation trend seems to be bubbling up and it getting enough traction. We have started, there has been some data on inoculating people against information. So this idea, like if we're rolling out boosters, we're rolling out the flu shot for this season. And we know that some people are being told things like, oh, if you take them at the same time, it's going to cause something bad, or they're out to give us something, I don't want to make up any experimental or any conspiracies now, because I don't want it to take hold and be like, she said it. So there may be little things that we know people might say. And so by inoculating people with that early and say, hey, you might hear some people saying that XYZ. I want to tell you why that's not true. This sort of idea of pre-exposing people, kind of like a vaccine, pre-exposing them to what they could hear. There is some evidence that can be effective at countering disinformation. That data just kind of came out in the past couple of months, from some researchers. And so that's something we're sort of toying with. How do we implement? But yeah, I think that also being more accessible. So the more we speak in a different language, the more you're allowed for people who are willing to speak in someone else's language to kind of fester and prosper. And so we've realized that's another reason that we have the ambassadors to go out and say, hey, we're going to tell you what's going on. We're going to tell you the information. You ask us any questions you have. You tell us what your friends down at the dock are going to say, and the people in the warehouse who work with you are going to say, and we'll give you answers so that when you hear that stuff, you can call it out as what it is. And I can't say it because it's in this church, but you know what I'm saying. How do we basically? We have to let our ambassadors help us speak that language. Oh, Miss Carolyn.
Do you want me to bring this to you?
I have both some comments and a question. About 40 years ago, I was teaching at one of the local university colleges, and I was in class, teaching, and suddenly I felt really sick. And I ended up dismissing the class. And afterwards, one of the students came up to me and said, I think you need to check out if you have hepatitis. And my reaction was, hepatitis? How would I ever have that? And she said, you have that look my roommate in the dorm had when she had hepatitis. And so one of the things that I was concerned about is why didn't the school, well, it turned out there were a reasonable number of students and also some faculty then who had hepatitis, that it would have been helpful to have known that. But also, I want to make a comment about the public health department. I tried calling various doctors, the doctors I saw, and when you said, I think I have hepatitis, they all said, oh, I'm not able to see you. You need to call somebody else. And so finally, when I gave up of finding a doctor, I thought, where do I call? So I called the public health department and said, I think I might have hepatitis, and I can't find a doctor. And the person asked me some questions and said, well, do you need to go to a private person? Do you care if it's some kind of clinic? Where do you live? Do you have transportation? And asked me different things, and finally ended up saying, I think you should check out the Kansas City Free Health Clinic. And so it was extremely helpful to get good information. I did call them. That's where I got an appointment. That's where I saw someone. So it was extremely helpful. But I imagine you can't spend time with every person who calls and says, help me find some place to go to. So that's one thing. And the other is what's done with the employer who doesn't pass on any information to all the people who are getting exposed?
Mhm. Yeah, that's fascinating. I have not heard of any widespread hepatitis. Oh, okay, yes. Any recently, but if that were to happen recently, or in these days, if someone were to, there seemed to be a cluster, what we call a cluster or outbreak of why are several people kind of in this area who live in a certain area or work in a certain area or spend time in this area, why do they seem to be getting diagnoses? What we would do then is we'd have to do a full public health study on to see if there's an outbreak and figure out where that might be coming from. One another way that we do that is if you do go to your doctor's office, and they test, they send those results to the state, and the state sends results to the health department, sort of an aggregate. So we are looking for trends, we're looking for clusters, we're looking to see if anything looks like it's kind of coming together, and then we would investigate. But to your point about not being able to find care quickly, like that is very unfortunate, and that's something to for us to really be thinking about. I have not heard that recently, but this does put my awareness up around it, making sure that people, if they do think they have something infectious or that they could have caught from other folks, that they know where to go get help for it. As well as our providers. Providers should not, our healthcare providers should not be saying, don't, I can't help you, call someone else. Like, that doesn't make sense. So I'm sorry that happened, and I hope you, yeah, good. I'm glad to hear that.
I'm throw in one more question here. You talked about the difficulty people had of navigating the bad information out there. One thing in this process, though, is that I think there's a lot of frustration that even from the highest official sources, early on in particular, the information seemed to be changing. I don't know if that was unusual or it was just more publicized this time, or questions. Maybe how would you have handled that?
How would I have handled this? Oh, but it's again, I would have the gift of hindsight. Um, Again, it kind of goes back to a word we talked about earlier, which is humility. So one of the tenets that I didn't even know of public health, is, and we've been talking about this a lot in this sort of hot wash, or this, sort of picking up the pieces of where we went wrong over the past few years. One of the tenets, or the core goals of public health is to be fast, to be first, and to be accurate, right? So we want to be accurate, but we want to be fast. Well, two, you can have one or two of those things, but you can't usually have all three of them at the same time. You can be fast, but you may not have the most, you can't also have the most accurate and the most informed information at the same time. And if you're accurate, it's going to take you more time. But in something like this, where people are starting to pass away around us and people are getting nervous and we're talking about airborne and all of that, people feel like we need to have information very quickly. What we have talked about is perhaps there should have been more discussion of what we don't know. I don't know right now if this is this. If I don't know that it's airborne, I don't know exactly how it's being communicated. You might want to start limiting your contact with other people, or you might, if you think if you think you should wear a mask and that's not going to hurt anything, then wear one. There was a whole bunch of discussion about why did you tell people not to wear a mask and then you told them to wear a mask. We feel like it would have been helpful to probably say we don't know more. This is a novel virus. This is the novel SARS-CoV-19 virus, right? Which means we have not seen it before. We've seen some other things that maybe seemed a little similar in the past, but this is novel. So when something is new, you should be able to say, I don't know. But so many of our experts felt the requirement or the demand to know and give answers to everything. I think that's a big piece. Going forward, we should have more humility, and to be able to say that. That's not satisfying to everybody, because some people will say, "Well, you should know. You're in that role. You should know." I understand that, but before I tell you something wrong, I'd rather say, "Give me another week or two." I'd rather tell you, here's the research we're doing on that. Because on the other hand, you move too quickly and people say, well, you move too fast. You don't even know you created that vaccine way too quick, So there is no pleasing everyone in all respects. And so I think the best way we can do is say, hey, I know you're struggling and suffering for information, but this is what I can tell you now. And this is what I need a little bit more time to figure out.
All right, Dr. Jones, thank you very much. I want to say thank you. Listen to Dr. Marvia Jones, Kansas City Health Director.
Thank you. Y'all have great questions. Have a great day.